Well, we know you don't really need a reminder, but this time, 2 years ago, we knew COVID was going to be a big deal in the world, but it's fair to say we didn't know how big a deal this situation would be. After an intense couple of years, things are starting to get back to normal, although that's one of those phrases you say with some hesitation. What's happening with COVID-19 and what do we need to think about as we do more outside our houses than we have in ages, it seems? Well, joining us again today is Dr. Joseph Blondeau. He's head of microbiology at Saskatoon's Royal University Hospital. He teaches about infectious disease at the University of Saskatchewan. And just a quick reminder here, Dr. Blondeau is not part of the policy decisions made by government. So I guess don't blame him. Dr. Blondeau, again, a microbiologist, but not part of the policy-making bureaucracy in Saskatchewan. So if you have a question for Dr. Blondeau about COVID-19 or vaccines, give us a call right now. It's 1-800-716-2221. You can email bluesky@cbc.ca. Reach us on Twitter @blueskycbc. And again, we will live stream today's program on the CBC Saskatchewan and CBC Saskatoon Facebook pages. So if you're following along on Facebook, just put your question in the comments section. We'll try to get to them as quickly as we can. So with that, we're once again very grateful to have Dr. Blondeau back with us again today. Good afternoon, Dr. Blondeau. How are you?
I'm fine, Garth. Thank you very much. And for yourself?
I'm well, thanks. And again, I want to thank you again. We can't thank you enough for you've been so generous with your time over the last couple of years. It's been a week since people here went maskless, or at least many people have gone maskless. Do we know if we're seeing more cases, or is it too soon to tell?
I think that it's probably too soon to tell what the impact of the restrictions being lifted are. I mean, there's no secret. We still have COVID activity in the province. We're still seeing cases. But we haven't, at least here at University Hospital, we haven't seen a noticeable spike in terms of our cases that we're testing for. But one thing we are seeing, though, Garth, is that we're starting to see a few more respiratory viruses that are typically associated with seasonal respiratory tract infections like the common cold and that sort of stuff. And so we're starting to see those a little bit more. Now, whether or not that's purely coincidental with the easing of restrictions, or if they were there and now we're just starting to see them as, sort of maybe people are starting to show up to get tested, that'll remain to be seen. But yeah, I think things are behaving, the way we would have expected at this point in time after the restrictions were lifted.
What else are people in your world talking about right now when it comes to COVID?
There's a few things that are being talked about. Of course, you know what? I'm going to sound like a broken record here, Garth, and I apologize for that. But the chatter that's still going on amongst all the professional groups continues to be the role of the vaccine campaign in order to continue to fight the pandemic. And so when you look at, the Canadian national data, more than 80% of Canadians are at least double vaccinated, and then of course a smaller percentage are triple vaccinated. And a lot of people, including myself, are attributing the success we've seen in regards to reducing hospitalization, particularly intensive care admissions and deaths, with that vaccine campaign. And so there's a lot of chatter there. Of course, there's always chatter that, is there a possibility we're going to see yet, another new variant arise that would be cause for concern and maybe look at a renewal of restrictions. That's pure speculation. Of course, we all know that, but it's still something that people are chatting about. And then, the other thing that people are chatting about, and I think this is of wide interest to the listenership today, is what do we do now that these restrictions are lifted and when we're still concerned about our own personal health or our family health? And here I think the answers are very, very clear, at least to my way of thinking. Again, sort of reverting back to my comments already about the vaccination campaign and where you fit in that. And also to recognize that it's okay as individuals, if we still wish to wear a mask when we're out in public or when we're interacting with people that we can't maintain a safe physical distance from, and how long we need to continue that's really going to be based on what the trends are and what everybody's level of comfort is in going back to sort of a maskless way of life. Um, we are getting comments in regards to, can I let people who are unvaccinated into my home and stuff like that? And I would say to you that, my answer to that is going to be the same at this point in time. The best way to protect you and the people around you is to be vaccinated and still to practice some of these previous public health mandated restrictions like mask wearing and physical separation. And it's really that simple to my way of thinking.
Okay, we're going to go to our first caller. It's Denis in Regina. Hi, Denis.
Hi.
Hi, go ahead.
I was wondering, so unfortunately, my family has all had COVID recently, Omicron. Myself, my husband, our kids, we've all had cases in the last month. Now that we've all had it and it's resolved, is there some level of comfort that we could have doing some things that we weren't doing before? For example, like we haven't been in other people's homes. I'm still comfortable wearing a mask when I'm out and about, but basically I'm eager to resume some activities, but I don't want to put anyone else at risk. And I'm wondering if now that makes us a bit safer that we've all had it.
Yeah, I mean, certainly having the virus will provide you with some level of immunity. But, there is some evidence that's emerging to suggest that if you've been infected with Omicron, it's possible that you can be reinfected with it a second time. Because you've had Omicron, and I won't ask you and put you on the spot, but if you've not been vaccinated, just because you've had the virus doesn't mean you're not eligible for vaccination. You certainly are after you've resolved your symptoms. And we do know that because not every individual responds the same way to natural infection in terms of the level of antibody protection that you have, it is possible that when you had it and you resolved it, your level of immunity, for example, may not be as robust as, say, somebody that went through the vaccine series. I don't always want to be reverting back to vaccination, but those are just facts that are in the public domain. But I think, having previously been infected and resolved it, yeah, you can have some level of comfort with that. But I would still not dismiss the value of vaccination.
You bet. And yeah, everyone that can be in my family is. We have a person under 5, so that's too bad for now. But yeah, no. I also wondered if we can still. Is there like a risk to other people? Can we transmit it? Can I catch it again and maybe not get that sick, but transmit it to somebody else that might get sick?
Yeah, I mean, if the virus, the simple answer is yes. If the virus is present in your oral cavity, then the risk for transmission exists. But, there is some evidence that, viral loads could be lower and the amount of time that you're actually communicable could be shorter, but that is not an absolute zero. And there are no absolute answers to this question. It's not a yes/no type of answer. It's a possibly yes, possibly no type of scenario. But I was reviewing some opinions this morning in anticipation of today's call-in show, and there are a number of expert groups out there saying that reinfection with Omicron is possible, even though we don't have a lot of statistics to back it up.
Okay, we're going to move on. We got a question here on Facebook from Sandy who asks, how long are you contagious after being infected?
So, we tend to think of from onset of symptoms to that 5 to 7 day range. Some people could be a little bit longer than that, but I think that if you've gone through, 5 to 7 days of isolation and you're asymptomatic, then your risk of being infectious is significantly diminished after that. I can't say you're absolutely not because it's not that clear. But certainly 48 hours post-symptomatic, your infectivity is lower.
And we got an email from Judy, and she's concerned after reading that the Pfizer vaccine effectiveness can be as low as 12% against infection for kids aged 5 to 11. What can you tell us
I've
about
not
that?
seen that. I've not seen that data. I would have to go back and search for it. So I can't comment on that because I've not seen that.
Fair enough. Let's go to James on the line in Saskatoon. Hi, James.
Hi, Garth. Yeah, I've got a question on the death rate with this. Now, I've been charting this over the last couple of years, and worldwide it's about 1 in 75, like one person in every 75 who is infected dies. And in Canada,
COVID?
that's with COVID. When you look at the number of deaths per million and the number of cases per million, and you divide the cases per million into the deaths per million, it's about just over. Well, it's over 1%, and worldwide it's 1 in 75. In U.S. it's 1 in 82, and in Canada it's 1 in roughly 90. Now, can we expect that rate to go down?
So good for you that you're plotting all of these trends. The sad thing is, though, is that unfortunately we really don't have the true denominator in regards to the number of people that are infected, and for a number of different reasons. First of all, when we look at global numbers, they may not necessarily represent what the true global population has actually experienced in terms of people that were both symptomatically or asymptomatically infected. And that's particularly true right now with Omicron, where the number of individuals that are asymptomatically infected may be much greater than those that are symptomatically infected. I think once we know the true denominator, we'll probably find that maybe the death rate was actually less than 1%. And for other viral infections that tend to have, seasonal occurrences like influenza, for example, the death rate tends to be less than 0.01% on an annual basis, based on a denominator that is captured. So I applaud you for those numbers, but I have to caution that we probably don't know the true the true denominator. Sorry.
So this would be higher, 100 times more fatal than the influenza.
Well, it certainly could have been. Some of the earlier variants could have been more fatal than influenza. But once again, without knowing the true number of individuals that were infected, as a denominator, it's really hard to put a calculation on that. You can put a calculation on it if you have a population that you're studying and looked at individuals that were, say, known to be negative but were positive and looked at the death rate, in a cohort of patients going forward. But that's very much different than trying to calculate on a global perspective when, for example, do we really know what the reporting system out of Asia is in regards to the number of true infections? Do we really know about South America and Africa in regards to the number of true infections? We only know the ones that were captured. We don't know the ones that were not. And so that's why it's very, very difficult to put an absolute number on that. But do I expect it'll be less than 1%? I do, and I'll have to eat my words if I'm wrong about it.
Okay, James, thanks for the call. We're going to move on to Marilyn. She's on the line north of Nacum. Hi, Marilyn.
Hi. So my question has to do with wearing the mask over your mouth, but not over your nose. We have some friends who, when it was mandatory, didn't wear it over their nose. Reason being that wearing it over your mouth and nose, you're breathing back, carbon dioxide?
Yep.
So I know that question's been asked lots, but just remind me of the truth or fallacy of that.
No evidence that's harmful in any way. When this question came up originally, I went over, I ran across the hospital to the other side, and I consulted with some of my friends and colleagues over in respirology, so these people who are lung specialists. And I said, help me to address this question because it'll come up again. And they said, absolutely no evidence that wearing a mask is harmful in any way. And they make the argument that look at OR staff and surgeons, nurses, respiratory therapists, anesthesiologists that might be in the OR all day long and are constantly wearing a mask. There was never any evidence that this was harmful to them in terms of what they exhale and whether or not re-inhaling that was problematic. Presumably, these gases actually escape through the masks because of the size of the molecules, so you're really not breathing them back in. But there's no evidence that I was able to find, nor my friends in ResMed, to say that this was a problem. The reality is, and I don't want to make anybody angry, is that people don't like wearing masks. And some people found it more comfortable not having the mask over their nose. And I certainly know, me personally, the mask irritates my nose. My nasal passage dries out, so I find it as an irritant. But not wearing the mask properly is the same as not wearing the mask at all.
Okay, Marilyn, thanks for the call. Got this note from Sharon on Facebook, and Sharon writes, I'm on day 10 after testing positive for Omicron. I have no more symptoms. Am I still contagious if symptoms are gone, but I still test positive on a rapid test?
Yeah, so I mean, the one thing that we've had a discussion about is whether or not you should be retesting yourself after you've tested positive, because you can get a retest, but now you're that 48 hours post-symptomatic. So the likelihood that you're actually contagious, or at least to a degree that you become a risk to others, is substantially reduced. So one of the difficulties, as I've said, with retesting is that what do you do when you get another positive? We do some of that in healthcare for different reasons, but in the general public, I think that if you're 10 days out and you're asymptomatic, your likelihood of being contagious is, again, no absolutes, because it's not 100%, but would be minimal.
Okay, let's go to Chris on the line in Regina. Hi, Chris.
Good afternoon, Garth and Dr. Blondeau. Had a couple of questions. I know that we're in a kind of a strange situation right now in Saskatchewan. We've had lifting of all of the public health restrictions, but I also know that February was the third most deadly month since the pandemic started for our province, with the number of deaths. And I just wondered if Dr. Blondeau could speak to a couple of things. First of all, does he know the numbers for how the deaths in Saskatchewan over the course of the pandemic compare to other provinces in Canada, and also how our vaccination rates in Saskatchewan compare to other provinces?
Yeah, so to the first question, I don't have those numbers right at hand, so I can't even attempt to answer that question. Although I will put this out there, and I don't know this as a fact, but I'll put it out there. There could have been folks who died in February of COVID who actually entered into the hospital before February. And they would be captured at the time of death. And so just keep in mind that sometimes numbers can be skewed a little bit because some people who went into the intensive care unit remained there for a long period of time, sadly, before they succumbed to infection. In regards to our vaccination rates, we tended to be a little bit behind the rest of Canada. And I didn't look this morning, Garth, and I don't know if you did, to look at what the percentage of the Saskatchewan population is fully vaccinated. But I know across Canada it's more than 80%, but I don't have the number off the top of my head of the numbers of individuals that have had their booster shots, but it's certainly less than those that have had their first and second vaccines. But Canada was not, but Saskatchewan wasn't 10 points behind the rest of the country. Tended to be a few percentage points behind the country, and then we caught up. So I'll stand corrected if our numbers are a little bit different than that, but that's my understanding.
Okay, Chris, I'm going to move on to this note from Shauna on Facebook. My family is on day 5 of being positive. I have an appointment at the hospital on Thursday. Can I still go to my appointment?
I can't answer that, Garth. I think what you need to do is you need to get in contact with either 811 or somebody at the hospital where you need to go and find out what those recommendations are. My recommendation could be a little bit different than what the policy is, so I'd rather you speak to somebody and say where you are and have them approve or not approve you coming in.
All right, folks, again, as he has throughout the pandemic, Dr. Joseph Blondeau, microbiologist, who also teaches about infectious disease at the University of Saskatchewan, is our guest today, and he's ready to handle any questions you might have related to COVID-19. And again, Dr. Blondeau brings us some good science-based answers to your questions. So do give us a call with whatever's on your mind having to do with COVID-19, the pandemic, restrictions, vaccinations. 1-800-716-2221. Email bluesky@cbc.ca or reach us on Twitter @blueskycbc. Again, that telephone number, 1-800-716-2221. Email bluesky@cbc.ca. Or if you're following along on our Facebook pages, just put your question in the comments section. We'll get to it as quickly as we can. We're going to take a quick news break in just a moment, but let's deal with this email from Diane. And Diane's got a couple of questions. First, how long should a double vaccinated person who has recovered from COVID wait for that third vaccine?
So you can go during your first period of eligibility. So long as you're not symptomatic anymore and you're eligible, then you can go.
Okay. And Diane's second question is, where has the Delta strain gone?
Well, it's typically true, Garth, that a virus that is circulating can be rapidly replaced by another virus, which seems to have greater contagiousness, and that seems to be what's happened here. People that originally had Delta either recovered from it or they succumbed to it. And then the population obviously then became at risk for the new variant, which was Omicron, and then the B2 subvariant of Omicron. And because these are more highly contagious than the Delta strain, even though Delta was more contagious than the original COVID-19 strain, they have become the dominant strains in this country and other countries around the world. So it simply has just vanished. Now, does that mean there's not a little bit left around? There could be, but it's certainly not predominant. If you look at the sequencing data of the strains that are currently in Canada right now, Omicron and the subvariant, the B2 subvariant, are certainly the ones that are showing up.
Okay, Diane had a third question that might take you a moment or two to answer, so I'm going to hang on to that. And Right now we're going to take a quick news break. Jesse Anton is standing by. Hi, Jesse.
Hi, Garth. Well, we're learning more about a crash this past weekend southeast of Melville. RCMP tell us, Garth, a 65-year-old man died and 3 young people were taken to hospital after their vehicle collided with a train. We'll tell you all we know about this coming up at 1 o'clock. Plus, as we bring you the latest on the war in Ukraine, we also have the story, Garth, of a Regina videographer living in that country right now. He's among those near the Poland border seeking refuge. We'll have his story coming up in our next newscast just after Blue Sky as well.
Thanks very much, Jesse.
You're welcome.
Jesse's back at 1 o'clock with details on those and other stories. Back to today's conversation. We're pleased again today to have Dr. Joseph Blondeau as our guest. Dr. Blondeau is a microbiologist, head of microbiology at the University of at the Royal University Hospital, and teaches about infectious disease at the University of Saskatchewan. So any questions you may have related to the pandemic, give us a call. It's 1-800-716-2221. You could email bluesky@cbc.ca or reach us on Twitter @blueskycbc. Again, 1-800-716-2221. Email bluesky@cbc.ca. If you're following along on Facebook, just put your question in the comments section. We'll get to it as quickly as we can. Now, Diane's third question was, how does testing wastewater predict COVID?
It's based on the amount of nucleic acid that's detected. So if you're detecting a lot, it means that there's a lot of COVID around. If you're detecting a little, it means that there's less around. So it's really looking at the ebbs and flows, tides related to how much of viral material is being detected in the wastewater. And it's been I have to say, I was a little bit skeptical in the beginning, but it's actually been a very, very good tool to monitor trends with COVID over the course of the pandemic. So congrats to the folks that have been doing this, I think really, really valuable work.
Okay, let's go back to the phone lines. Sarah is in Regina. Hi, Sarah.
Hi, Garth.
Go ahead, Sarah.
Thanks, Dr. Blondeau, for being so available. I echo everyone else's gratitude over the last couple of years here. My question is around long. My question is around long COVID. I've been trying to find some information around the rates of people who get infected with Omicron getting long COVID. Are there people with certain health conditions that are more likely to get long COVID? And I'm just having a bit of a problem finding any data, and I'm wondering if you have any you could share.
Yeah, so, there's some good data sets that have come out of the United Kingdom. So if you do a search out of the UK, and search based under long COVID, either under the United Kingdom or Britain or something like that, you will have some information that came up. There was one study that I can comment on for sure, looked at over 1,000 people that were hospitalized with COVID, and then looked at the percentage of those people that ended up having long COVID. Now, there were different definitions of long COVID. We talked about some of the symptoms that people experience. There could be some respiratory, some neurological, some cardiac, etc. This phenomenon of brain fog. There was loss of sensation of taste and smell, etc. But a couple of the important observations out of one of the studies out of the UK was that when they looked at individuals that were diagnosed with long COVID, and some of these patients had symptoms that were persisting for longer than 12 weeks, the two pieces of data that stood out for me was that about 19% of individuals that were diagnosed with long COVID, when they returned to work, they required some type of accommodation within their workplace in order to help them to adjust back to the work environment because of some of the symptoms or some of the lingering effects of long COVID. So that was one piece of data. The other piece of data was about 20% of people that had been diagnosed with long COVID were not able to return to work. And I have to be careful here to say it's not because they didn't have a job to go back to. These were people that were employed prior to the pandemic. They had a job to go back to, but because they had some disability associated with long COVID, were no longer able to return to the workplace. I do have a friend that experienced long COVID here in Saskatoon. And that individual has told me about a number of things that they had experienced, and particularly some of the neurological observations, particularly around not remembering just common, simple things. And they had to relearn just some basic language that they just couldn't think of the word, like I use an extreme example, like a fork. Couldn't think of what a fork was called and had to relearn that. There's also some literature that came out of the UK actually talking about the potential impact that COVID had in long COVID sufferers in actual brain observations and in terms of scans that were done. So that data does exist out there. I wouldn't say that it's a global collection of data, but you certainly can find it using those sort of search parameters.
Great. Thank you very much.
Thanks, Sarah. Okay, Sandy is in Kelvington. Hi, Sandy.
Hi, can you hear me?
Yes, go ahead, Sandy.
So this is maybe it's too complicated to ask, but I have a niece who is immunocompromised, who has had her booster shot, but her condition probably makes the shots useless. She's on moderate doses of prednisone right now, 40, I think, a day, and she's on a drug, Cellcept, that calms down her immune system. So we have been, as a family, in complete, almost isolation for the last 2 years. And I am talking complete isolation. We stay away from people. We don't go into stores. We don't do anything.
Yep.
And some members of the family have had it, and I get that.
Yep.
And so they want to rip the Band-Aid off. And I'm wondering, how much can we rip the Band-Aid off? If this niece is that compromised, and she just went through, I don't know if you know ITP or Evans syndrome, but she just went through and is continuing to go through an episode of this. She has a sister that wants to meet a boyfriend, quit wearing a mask, period. What would your suggestion be? We keep our masks. We're all triple vaccinated. Do we keep our masks on under every circumstance, whether it's in a store, whether it's outside.
Well, first of all, I absolutely appreciate the difficulty of the situation that you find yourself in. And I absolutely appreciate the difficulty of trying to protect somebody who's immunocompromised and keep them safe. Your question is a very complicated one, but I think the answer can actually be quite simple. I mean, because we don't know, there's two things that we don't know. First of all, we don't know whether or not the vaccine had produced a lot of measurable antibody in the individual you're speaking of, but we can assume even with a weakened immune system, there was probably some benefit. What level of protective antibody they might have is very, very difficult to guesstimate, and we don't even have a good system to measure that. So that's the second thing. And the other thing that we have to keep in mind is that the vaccine is not 100% efficacious. Despite the fact the numbers are high, they're 80, 90%. Some vaccines, depending on the study population, were 70%, et cetera. So it's technically possible that somebody who was given the vaccine, whether you're immunocompetent or immunocompromised, may not have had a favorable response and produce the type of antibody. So for me, if it was in my family, I would say that I have to continue to do whatever I can to protect that individual. At some point in time, though, it might be worth your value to try and speak to somebody who's an expert on this individual's state of immunocompromise, and to try and see whether there's any type of testing that's available, either commercially or otherwise, to see whether or not you can see a little glimmer of evidence as to whether or not they have some level of protection or not. And that's not a discussion you can have with me, but certainly a discussion that you can have with somebody else, and to see whether or not there's anything that you can do to get a little bit more information. But to me, I think it's important to protect the vulnerable. And if that means that, you're in a situation where you still need to practice some of these measures, then if it was in my family, I suspect that I would do the exact same thing that you've been doing.
So what I think I hear you saying, because we have asked the specialist, are there tests? He says not at this time. She gets IgG antibodies weekly, but they don't know. Right. And some of them are like a year old, so she might not have antibodies. Anyhow, what I hear you saying is keep a mask on. Keep doing what you're doing.
Yep. Yeah. Until we have evidence that there's no more viral activity, or that the rates have just dropped down so low that risks become negligible or minimal, we're not there yet.
So we don't even go into a store, like we only wear N95 masks, but we don't even go into a store with an N95 mask on. And now that there's no masking requirements, you would say, yeah, don't go into that store. Keep doing what you're doing.
No, I'm saying that, if you're wearing a high-quality mask like an N95, you're protected. But an N95 means 95%. It doesn't mean 100%. And so, you're going to have to gauge, your comfort level with even minimal risk as to whether or not you want to, potentially put this individual in a circumstance where they could potentially be exposed. This is a really tough question, a very complex question. But, at the end of the day, you need to do what you need to do in order to keep this person safe.
Okay, Sandy, best of luck. Thanks for the call. A quick email from Bob here. This is a bit of a blast from the past. Bob wants to know how we should be handling items coming into our home, like mail, groceries, takeout orders. With the previous variants at the beginning of the pandemic, we were wiping them down with soapy, bleachy water or sanitation methods. Yeah. Is that necessary?
Garth, the opinion on here has evolved to sort of say that, transmission of this virus from inanimate objects like this is a low-risk situation. Once again, it's not 100%. So, if I was a fully vaccinated individual, I would probably be less concerned about that than I would be, coming in contact with people who are unfamiliar with me. The option still exists if it's a concern for you to wipe down some of these objects. Is it possible you could transmit the virus this way? Yes, but it is considered to be a low-risk transmission scenario.
Okay, and on Facebook, Kathy asks, are you aware of any variants on the horizon? If yes, what's the risk?
I'm not. No, I haven't. I haven't gone to the World Health Organization to look at. There are a number of variants, Garth, that have been registered. And, the two right now, obviously, are Omicron and the B2 subvariant of Omicron. There are other variants that have been registered, which have people had a look at them, but they really haven't done anything. And so, am I aware of a new one that's out there that's a cause for concern? I'm not, but hell, that could change tomorrow.
Right. Okay, let's go to the phone line. Dan is in Saskatoon. Hi, Dan.
Hi, Garth and Dr. Blondeau. Thank you again for all your help. I just wanted to talk about the caller is talking about masks and CO2. My granddaughter, 10 years old, last year, I think, participated in a research study at the university, and it was regarding with hockey and masking and unmasking. And the results of that were, as I believe, that the CO2 levels were not changed whether the mask was on or off.
Yep.
And it was both on ice study and on the bicycles in the lab.
And there were two aspects. I did not review that study, but I am aware that a study like that was going on. There were two aspects of it. One of which was what happens under normal circumstances. So if a person's just walking or sitting or talking or doing a bit of shopping, and they have a mask on versus somebody that's doing high intensity exercise, and would there be a difference? And I believe that my understanding is the same as yours, was that there wasn't found to be a difference, which means that we would expect these gases to be able to get through oxygen, to get through the mask for us to breathe it in, and CO2 to escape from the mask as we exhale. So I think that your comments are consistent with, the expert opinions that I sought myself.
Okay, thanks for the call, Dan.
Thank you. Bye.
Thank you.
Thank you.
I'm thinking of the Canadian women's Olympic hockey team wearing masks and winning the game convincingly. Last time you were on the show, you talked about the new vaccine that's been approved. How close are we to getting it?
I haven't seen. I was trying to look that up before I come on because I anticipated a question might come up. But it's gone through all of the approvals, but I haven't seen a distribution timeline yet, so don't know. I do know, though, that they've released some more data, and about 90% effective was the latest number that I reviewed. And this was in individuals 18 years of age and older. So, what my opinion, Garth, on the latest vaccine is that the more vaccines that we actually have out there and available in circulation, then the better it is for the population. So I think this is a welcomed addition.
Now, we got a note from Neil on Facebook, and Neil writes, I sing in a choral group, and we started in-person rehearsals a few weeks ago with masks, distancing of 3+ meters, and full vaccination requirements. So what COVID measures should we continue to practice going forward, if any, and for how much longer?
Yeah, that's really an unfair question and a tough one to answer, because actually, singing is one of these high energy activities where you're actually liberating more potential exhaust, virus, whatever. So it's technically possible, even with everybody immunized and whatnot, you could still have somebody in your choral group that could be positive. And even with your distancing, I think it's a big help, and you don't want to have your masks on when you're singing. But, it's technically still possible that the virus could circulate under those circumstances. So, again, a tough question because it's not a yes or no answer. But continuing to practice distancing when you're doing these types of activities, I think, is probably your single best strategy, along, of course, with being immunized, etc.
Okay. I got a tweet from Barry. Barry wants to know, what's the percentage of Omicron variant that can be detected by a rapid antigen test? So I guess he means how infected do you have to be?
Yeah, I don't have that number. I tried to look that number up 2 weeks ago when I think I had a question similar to this, and the answer that I got when I went to a couple of manufacturing sites was that the rapid antigen tests seem to be particularly good in picking up the virus, but the sensitivity of these is not 100%. It could be in that 70 to 80% range, which technically means that you could be positive but test negative. That's the best I can do with that particular answer. I don't know. Obviously, if we really wanted to know and you were symptomatic but test negative, there are two possibilities. The test wasn't picking it up and you can get a PCR test, or you have another respiratory virus, and we certainly can test for that as well. But I can't do much better than that on that answer.
Okay. Got a caller on the line. It's Marvin in Carrot River, and I think Marvin has a follow-up to a question he asked last time you were here. Hi, Marvin.
Sure.
Hello. Yeah, the question was regarding the discovery of a mask at the University of British Columbia that would kill the virus upon contact.
Yeah. I tried to get some information on that, Marvin, and I wasn't very successful. I don't know what the component is. Either I didn't look in the right place, and I did actually consult with one of my colleagues here in the province, and they were unaware of it either. So I still have a little bit of homework to do on that.
Okay. Sorry, Marvin.
No, thanks for trying anyway.
Yeah,
okay.
Yeah.
Okay, I got an email here from Cindy. Cindy writes, what has this phenomenon taught us about post-viral effects? Are they really due to the virus or to our immune system response to the virus? Has this changed our understanding of conditions like chronic fatigue syndrome or fibromyalgia might some of these hard-to-diagnose conditions really be the consequence of an unnoticed or minor illness? Interesting question.
It's a really intriguing question that she has asked. I don't think the average person understands how powerful the immune system is, and to give you a for instance, Garth, a patient can come into the hospital with an infection. So let's just say they have pneumonia and they get admitted to hospital and unfortunately end up in the intensive care unit. The body mounts this massive response. And because the response is so massive, it could be the response itself which actually ends up resulting in the patient dying, and not necessarily the presence of the bug itself, although it was the bug that precipitated the response. And so I think that, to answer the question that has been asked, I think some of the long lingering effects most definitely are due to the immune response. And there are some that are clearly due to the presence of the virus, particularly if the virus has resulted in direct tissue damage to which the body then has to repair and recover from. So I think that the answer to your question is actually twofold. There's absolutely no doubt that virus can do direct damage to cells and tissue. And there's absolutely no doubt that the power of an immune response can also lead to longer lasting symptoms. And it could be a combination of both of those things that could be responsible for, maybe some of the long COVID related symptoms that some folks are experiencing. Certainly it's related to why some people die.
All right. All right, folks, we've got a couple of lines open. If you have a question for Dr. Blondeau about COVID-19 or vaccines or really anything to do with the pandemic, here's your chance. Give us a call right now. It's 1-800-716-2221. That's 1-800-716-2221. You could also email Blue Sky at cbc.ca, tweet us at Blue Sky CBC, or if you're following along on Facebook, on our Saskatoon or Saskatchewan Facebook pages, simply put your question in the comment section. We'll get to them as quickly as we can. Again, that telephone number, 1-800-716-2221. Let's hear from Ken in Saskatoon. Hi, Ken.
Thanks, Dr. Blondeau. Always appreciate you being on. Really appreciate the information you provide.
Thank you.
Just looking for really a quick update in regards to vaccines and the potential for vaccines from those young kids 0 to 5. I know a lot of parents are on standby, just waiting for them to come out, and we're certainly one of them. And I know there's been talks because of Pfizer's kind of updates and them having to go back and do more trials and those kind of things. Just wondering, can you provide an opinion on them, where they're at, and also any advice to parents with young kids? Just hang in there kind of thing. What if you could provide that?
Yeah, so certainly hang in there. I keep looking for updates. I've even reached out to a couple of colleagues that I know to see whether or not they have any updates. And the reality is that we haven't seen much in terms of data or a suspected approval date, and then obviously a release date for the actual product. I have no doubt that it will get approved for use in the younger age groups. I think it's still a matter of time. And, you know, the fact that companies have been asked to go back and do some additional studies is all related to the fact that nobody wants to approve these things in these younger age groups unless we're absolutely sure they're safe. And so that would be the driving force behind having these younger age groups continue to be investigated further. If there was a question of efficacy, then the only way to deal with efficacy is to test a larger group of individuals in order to see whether or not that efficacy holds the same or whether or not it's improved with a larger group or even, I guess, diminished in a larger group. But those would be the reasons for sending it back. But I think safety would be number one. So it's just, you know, hold tight. I do think that we will see these vaccines coming and approved in this age group. Just can't honestly tell you when I think that's going to be, sadly.
Appreciate it, and thanks for that info. We're all keeping calm and staying on the track kind of thing, but it'll be such a breath of fresh air once we're able to do that. So thanks for this update, and appreciate it.
Oh,
right,
100%.
thanks.
You're welcome.
Thanks for the call. Let's move on to Marilyn in Regina. Hi, Marilyn.
A question for Dr. Blondeau. I've had 3 of the shots, so the 3rd booster was my last. I'm wondering, I've heard that the longer you have had the booster in you, the less effective it is. So I'm wondering if I can have 4th booster and how long I have to wait for it.
So I don't have any information, including dates or eligibility in regards to a 4th shot. So I can't answer that question. That will come from the expert working groups on vaccine. But I would like to repeat, though, the data that's available from the Canadian government and available for anybody to go and look at. Just put in your search bar hospitalizations Canada, and then click on the Government of Canada website when it comes up. And what the data clearly shows, just so you can be reassured, is that we know that that Omicron can occur in vaccinated individuals, and about 35% of cases of Omicron are occurring in people who are considered to be fully vaccinated. But if you're fully vaccinated and have an additional dose, so you have the booster dose, then the percentage of people being infected drops down to about 7% from 35%. When you look at hospitalization data, this is the important stuff. If you're fully vaccinated, about 18.5% of people that were fully vaccinated ended up in the hospital. But if you were fully vaccinated and had the booster dose, then only about 6.6% ended up in the hospital, showing that the booster dose does make a difference. And then when you look at the death rates, about 16% of people that were fully vaccinated still died with COVID-19. But if you were fully vaccinated with the booster shot, that number drops down to 8%, so half of that. So I think what that data tells us is that being fully vaccinated offers a level of protection, and certainly much more than if you're unvaccinated in leaps and bounds. But having that 3rd dose offers another level of protection to protect against hospitalization and death. So a 4th dose is likely to be announced at some point in time, and the eligibility for that will be announced, but I don't know when that's going to be.
Okay, we're going to move on to Daisy in Regina. Hi, Daisy.
Hi. I just had a question about masks, probably an old question, but the blue and white mask, I have one that says ASTM F2100, and it claims to be 95 to 98% effective at filtering bacteria. Anyway, a bunch of other things. I'm just wondering, this F2100, ASTM F2100 mask, is it, if it's completely sealed around the edges, is it as good as N95?
So N95s are the best masks that are out there, and that's my understanding. So if it says it filters out X percentage of bacteria, you can't equate that to viruses because viruses are much smaller than bacteria. Bacteria is a much larger molecule than a virus. And so you'd be looking to see whether or not there's any indication of what its filtration or its efficacy rate is in regards to viruses. But my understanding is an N95 is the best one that we currently have. Other masks that are available will have efficacy rates that range anywhere from 30 to 50 to 60%. Which, if you recall back a few weeks ago, I had said that when we were really concerned about, the peak of the Omicron current wave, was that by double masking, you actually improved the efficacy by having two masks on if you couldn't get an N95.
Okay, Daisy, we're going to wrap up here pretty quick because we're almost out of time. But before we go, Dr. Blondeau, what's your kind of best standard advice for us at this stage of the pandemic?
I think that, it's, I like anybody else, Garth, we're thrilled that, restrictions are being eased and life is starting to resemble a little bit more what normal looked like prior to the pandemic. But at the same time, the virus is still here. And I still think that there is a reason that we should all be concerned to, try and maintain some level of protection for ourselves and our families. And if that means continuing to wear a mask for a while, if you're comfortable doing that, then that's probably reasonable. And then again, I can't not underscore enough the importance of the vaccine program.
All right. Dr. Blondeau, thanks for your help again today.
It's my pleasure as always. Be safe.
Dr. Joseph Blondeau is head of microbiology at the Royal University Hospital in Saskatoon and teaches about infectious disease at the University of Saskatchewan. Well, tomorrow's International Women's Day, and we will hear from some women who work in sectors that have historically not had many women in them, like STEM and oil and gas. We'll look at what's happening to close the gap. We mark International Women's Day tomorrow at noon.